One day, a 36-year-old man named Ray came into my office with terrible low back pain. He'd been injured at work, and his place of employment sent him to a workers' compensation doctor. Now, that doctor prescribed medication and bed rest. When that didn't work several weeks later, he then tried a stronger medication. And then finally, after no improvement, 6 weeks of physical therapy was prescribed. All of this treatment was no help, and as a result, the doctor gave him 3 steroid injections. The first was slightly helpful, the second was less helpful, and then finally the third was no help at all. In fact, Ray was slightly worse at the end of those 3 injections than he was when this whole thing started. The workers' comp doctor sent him to an orthopedist. Now, the orthopedist then recommended an MRI, and from that MRI, the doctors determined that Ray had a series of bulging discs, L4, L5, S1, and then they recommended a lumbar fusion surgery. Is any of this sounding familiar? Before the surgery, Ray came to me for a consultation. Give me 30 days, I told him. Because workers' compensation would not pay for my services, coming to our office was a tough decision for him. He had the option of getting opened up for free or paying out of pocket to try something less invasive. If my treatment didn't work, he could always get the surgery, I reminded him. Initially, anyone in that situation would think that, well, workers' compensation case managers, don't they know best? Unfortunately, that is not the way it works. The unwillingness of workers' compensation to pay for chiropractic services is not a reflection of our effectiveness. Rather, it's a testament to their desire to seek more traditional and more profitable courses of treatment. Ray agreed to try chiropractic treatments for a month. During that month, we treated him 12 times. At the end of that month, he was back at work with no symptoms whatsoever. Ray's situation is not an unusual one. Yes, there are times when surgery is necessary, such as when bladder or bowel function is affected, or when nerves are impinged so bad that they're causing muscle atrophy. However, if you go in and surgically fuse those levels together and the surgery does not help, your options for any conservative future treatment is extremely limited. And unfortunately, the odds are not in the surgery's favor. Often it doesn't work. They call it failed back surgery syndrome. Understand that this is an actual diagnosis and is happening way more frequently than you may realize. This has been an excerpt out of my book titled The True Power of Chiropractic: Unlock Your Body's Natural Ability to Adapt, Renew, and Restore. This is available on Amazon, but for more information or to make an appointment, you can go to our website at www.chiropracticsportscare.com and click on Schedule an Appointment.